Hey guys, so today I'm going to do my 22-week update, but before I do all of that, I'm kind of going to explain my whole pregnancy just because this is actually my first pregnancy vlog, so you guys really haven't heard anything about my pregnancy in the past 22 weeks. It was on Father's Day, and me and Robert, my boyfriend, we went to Walmart and bought the clear blue tests that say like how far along you are. And so we bought a pack of 3. We came back and we took it, kind of waited for 2 minutes, and then we both went up to the dresser, turned the test over, and saw that it said pregnant 2 to 3 weeks. Well, at this point I was 4 weeks along, 4 weeks and 1 day, I believe. It was not really shocking just because I'm very good with tracking my periods, and I already knew if I was 30 days late that there was really no going around it. I've only been that late like twice before. Robert was really quiet and I was just like, this is really happening. Like, I never thought this would actually happen. We just kind of started going all over the place, talking about everything that we could think about: school, work, everything. The next day I made an appointment with like one of the first doctors that was covered by my insurance. Didn't even like pay attention to her reviews or anything. Her reviews looked average, so whatever. And they scheduled me for 6 weeks, so 2 weeks later. And we went to the appointment, me and Robert, and when we got in there, it was a very nice, clean office, and right away this ultrasound tech did an ultrasound, and I was super shocked. I was like, what? I was not expecting an ultrasound on the first visit. So I actually got very excited, just to, be able to actually see that. And so she did it. She even found the heartbeat. We listened to the heartbeat, and that's when I knew. I was like, okay, this is real. So they gave us some pictures. Then the doctor came in, and she kind of just went over everything that I should know, what I should do, what I should eat, how much I should gain, and everything like that. And at first it was all good, but then she, at the end, like, she was about to walk out, and I'm like, oh, I have some questions. Like, normally a doctor would ask you, like, do you have any questions? So, I mean, I kind of found that rude, but whatever. So I asked her some random questions, and she answered them for me, and she didn't really give me, like, a good answer. Like, she was just like, yeah, blah, 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 or whatever. So then we walk out to make our appointment, and this lady is on the phone with, I guess, a patient who had Medicaid, and she was giving her attitude about that she needed to get a new insurance in order to be covered, and she was just being really rude to the lady. And I'm pretty sure even at the end she hung up on the lady, but that whole time we were waiting for her to schedule us, and really she could have scheduled us, because at first it was another lady talking to that patient, and then she was kind of just listening in instead of paying attention to us, scheduling us, which takes 5 seconds. And yeah, so we were waiting a while, and that kind of bothered me too. But we left. We were happy. We were happy that we got to see the baby on the ultrasound. And yeah, so I mean, at first I was like, yeah, I love the office, blah, blah, blah. I mean, they were kind of rude, but whatever. And then as days went on, I just kept thinking about it, and I'm like, this is my doctor that I'm going to be seeing every few weeks, and who's going to deliver my baby. And I want to be happy. I want to be comfortable. I want to feel welcomed when I come into the office. So but then I was like, oh, but they do ultrasound, so blah, blah, blah. So I was all excited about that. And then I was like, you know what? I mean, honestly, this is a big thing. So I started looking for new doctors. I searched on Yelp and on health grades and stuff, and I found a doctor, and I went to her at my 8-week appointment. Now before that, same at 8 weeks, is finally when I decided to tell my parents. I think I had tried to tell them at 7 weeks, and I just could not step my foot out of my door to go to the living room and tell them. So I came up with another way of telling them. I just, for some reason, could not get it out of my mouth to them. So I got a piece of white paper, I folded it in half like a little card, and I wrote on the front, thank you for everything that you've done for me. I really appreciate everything, and I know that you guys will always support me in everything that I do. And when you open it up, it says, congratulations, you've been promoted to grandparents, with the picture of the ultrasound. So I made 2 of those, and I handed it to them, and they read it, and I was just kind of staring at them. I even started crying, staring at them, and they were just kind of like, for real? Like, is this serious? Like, you're pregnant. And yeah, so I mean, it wasn't as bad as I thought it was going to be. They were just very shocked. I mean, what do you expect? And yeah, so we just, same thing as with Robert. We just started discussing everything, school, and, what I plan on doing with Robert, if he's going to move in, or what we're going to do. And so yeah, I mean, it really went pretty well. Okay, so then I scheduled the appointment with my new doctor, and my mom wanted to go with us. So it was me, Robert, and my mom. And so we went in, very nice. The same lady I talked to on the phone, which was very nice when I talked to her on the phone, greeted me at the entrance. And then we were taken in pretty soon afterwards. And right away we started with an ultrasound. And I was like, awesome. Like, same thing that I loved about the other office, and they're doing it again. So I was like, perfect. And they started with the ultrasound. The ultrasound tech was super nice. She's like a young girl, but she was super like peppy, and she just made us comfortable, especially since it was a transvaginal ultrasound. And yeah, so I mean, I was happy so far, and they did the ultrasound, saw the heartbeat, everything was perfect. And then we went to go see the doctor, and the doctor kind of just talked to me, same thing, kind of everything I needed to know, and asked me some questions. And then she knew I had, so sorry, my camera got cut off. She knew I had gone to another doctor, so she asked what it was about that doctor that I did not like. And I told her that she was cutting me off. She wasn't very, inviting. And so the doctor was like, okay, ask me whatever you need to ask me. Let's go step in my office. I don't have any patients until later. And we literally sat in her office for about 30 minutes. And we just discussed everything. I asked her what she thinks about, C-sections and inductions and everything like that. And, she gave me all the answers that I needed. And when we left that office, me and Robert, because we had experienced the other doctor, we were like, oh my goodness, this doctor is 10 times better. Thank God we changed. And yeah, so then we were scheduled for, I forgot what week it was, but we had to go to the high-risk doctor and do a nuchal translucency, which I think shows if the baby has a chance for Down syndrome. And so they did that, and they said it was fine. Then at my doctor's office, they did a blood test, I think one of my next visits after the 8-week visit, and they tested for three different like birth defects and stuff like that. They did find that I was a carrier for cystic fibrosis. So then what they told us the options was that Robert needed to get tested and see if he was a carrier. And if he was a carrier, then the baby could get tested to see if they're a carrier or if they have cystic fibrosis or if they don't have anything at all. So we went to the high-risk doctor and they tested him for that there. We got the results like a week later, and He wasn't a carrier. We had to pay $170, so $170 wasted, but at least now we know, you know, we don't have anything to worry about. And then at 18 weeks, we had the anatomy scan where they check all the parts of the baby, and everything looked good. They could see everything. The only thing they could not see clearly was the heart, and they wanted to make sure to be able to see like the 4 chambers and everything else. You know, the heart is very complex. So they told me to come back, I think in 3 weeks, and then 21 weeks. And then I did the anatomy again. They were able to see, so this was last week. They were able to see the 4 chambers clearly, and then the doctor mentioned to me that there was a little white spot, and that was a calcium deposit, and that I had nothing to worry about, but if I wanted to, you know, put my mind at ease, I could do a DNA sequencing test, and that pretty much just tests all the DNA, and it'll show what the calcium deposit means is that the baby could possibly have Down syndrome, but that he said I had nothing to worry about. It should go away within a few weeks or by the end of the pregnancy. And yeah, so at first I signed a waiver saying I didn't want the test. But when I was signing the waiver, it said the name of the test. And I remember from the weeks before when I took that test for the 3 different, the cystic fibrosis and other defects, I remember that my insurance did cover this DNA sequencing, but only if there was an indication that you needed it. And obviously before, I was not considered high risk at all, so the insurance wouldn't have covered it. And now that there was an indication that there is this calcium deposit in the heart, it would be covered by insurance. So I asked the lady when I was signing, I was like, oh, I think this is covered by my insurance. And she's like, yeah, probably if there's an indication. So I was like, okay, I'll do it. I mean, it's covered. Why not put our minds at ease? So they took the blood for that, and we're still waiting on that. It takes like 2 weeks. So it was last week. So we'll know in a week. And yeah. Okay. So as far as the whole pregnancy goes, I have had a very easy pregnancy. Very surprising. I thought maybe, you know, it'd be a little difficult. But my mom did tell me that she also had very easy pregnancies. So I guess that's why. I think a lot of it has to do with, you know, genetics. So, I mean, in the past 22 weeks, I've had very, very mild, well, and this was before, this was in the first trimester. I had very, very mild nausea. No vomiting, did not vomit once. There was just a couple times where if I hadn't eaten food, or if I was hungry and I even took a sip of water, where I was kind of like, ooh, like I didn't feel good, but it was nothing extreme. And then in the very, very beginning, I had cramping, which, I mean, everyone knows that's pretty normal. It's the implantation of the, you know, the baby into the uterus. And so I did have some pretty bad cramping, but that went away. I've had a cold, you know, normal, but then I also had bronchitis, and that was bad. There was just a day where I literally could not breathe. Like, I was out of breath if I just walked to the bathroom or anything. So I decided to go to urgent care. They said that, you know, they really didn't know 100% what it was, but that they were just going to give me some safe antibiotics for bronchitis. So they did that. Another symptom is hip pain. I've had hip pain previously. Very mild. Now it's a little more intense, but it comes and goes depending on what I do. If I'm very active, I will get hip pain. And at first it started in the left, and now I have it sometimes in the right, but it's still more on the left. And it's really bad when I'm like turning over in bed. But other than that, it's okay. And that's pretty much it for symptoms throughout the week, throughout these 22 weeks. I really haven't had much. And then cravings, the entire pregnancy, I have craved pizza, and not necessarily like crave like I have to have pizza. It's more of like if I don't have anything else to eat, I will eat pizza. If you tell me let's go eat pizza, I'll say yes, let's go eat pizza. And then there was a couple times where I really wanted a strawberry frosted donut with sprinkles from Dunkin' Donuts. So that was short. I went one day they didn't have, so I was all like, oh. And then I went another time and they did have. And then the other thing is a cortadito. So if you don't know what a cortadito is, it is a coffee, very strong Cuban coffee with milk, steamed milk. And for like a week, I just really always wanted a cortadito, just one, drink it really quick, and that's it. But I only had like one or two in that week. So at 20 weeks and I think like 4 days, I finally felt Amanda, very lightly, you know, that bubbly feeling, very down like below. And then last week, or this like the weekend, I think I just had turned 22 weeks. Robert felt her. We were watching The Walking Dead and I started to feel her and I was like, give me your hand. And so I put his hand there and he was like, oh, because it just, you know, like a little bump. So as for 22 weeks, cravings, Kit Kats for some reason, and Subway. Subway, not so much a craving, it's just, it's the only thing that I'm interested in eating. And symptoms, still the hip pain, occasionally. My total weight gain is 12 pounds. So I think that's good and bad. I just need to keep it down from here on out. I want to, and the doctor said, to gain a total of 20 pounds. Now I know 8 pounds for the rest of the pregnancy is going to be pretty. Sorry, my camera cut off again. So I know that gaining 8 pounds in the rest of the pregnancy is going to be pretty hard, but I'm going to try my hardest. And last but not least, for 22 weeks, it's been pretty difficult to sleep. Not so much to fall asleep and stay asleep, just my positioning. So obviously laying flat on your back isn't good because the baby can squish some vein. And so I did read that you can put a pillow so that you can lay back and have your hip lifted so that the pressure isn't being put on that vein. So I've been trying to do that, but I end up moving the pillow or something like that, and then I tried to lay on my side, but I end up rolling on my stomach, and since my stomach still isn't that big, I don't really like notice it, but I always put my leg up to kind of not put so much weight on my stomach, and it's just, for some reason I can't stay on my side. I'm either going to flip on my back or flip on my stomach. So that's been pretty difficult, but I mean, sleep itself has been fine. So yeah, that's pretty much it. I'll go ahead and show you my belly, and I will see you guys next week. So sorry if this is a bad angle, but this is the belly at 22 weeks. It's still, I mean, it's pretty hard, but it's still not very round. And from the front, hopefully you guys can see well because I can't see what it's showing. And yeah, that's it for this week. See you guys next week. Go ahead and subscribe to keep watching the rest of these. Sorry this video was so long, but I kind of wanted to explain my whole pregnancy. Bye.